Hi, my name is Angel Sabo. I am a nurse practitioner and coordinate care for patients in the asthma clinic at Summa Health. I am here to talk to you today about asthma, what it is, and how to manage an exacerbation. Asthma is a chronic disease of the airways, also known as bronchi, to your lungs. It can cause swelling, narrowing, or spasms of the airways and extra mucus production. The most common symptoms include shortness of breath, wheezing, chest pain, and cough. It is unclear what causes asthma, but it is likely a combination of environmental and genetic factors. Asthma may be diagnosed through a pulmonary function test and other blood tests, such as allergy testing. There is no cure for asthma. However, following a plan with your pulmonary provider can help control asthma. Even with adherence to a plan of care, you are still at risk for flares or exacerbations. Worsening respiratory symptoms, including increased shortness of breath, cough, and wheezing, are signs your asthma may flare up, and additional steps may be needed to control your symptoms. An asthma action plan will help you identify early signs of a potential problem, how to take action on your own, and when to seek treatment from your pulmonary provider. There are a few key things you can do to manage your asthma at home, including 1. Make sure to keep routine follow-up appointments with your provider. 2. Monitor your peak flow daily. 3. Avoid triggers. Triggers can vary from person to person and may include exercise, cold air, humidity, pollen, dust mites, mold, pet dander, reflux, respiratory infections, and smoke, personal or secondhand. 4. Take your medication as prescribed. 5. Smoking cessation. The asthma action plan that we use at Summa includes zones. If you are in the green zone, you are doing well. Your symptoms are controlled and your peak flow is more than 80% of your personal best. At this time, you should continue taking your control and maintenance medications as prescribed. Remain active, eat healthy, manage stress, avoid triggers, and keep all appointments. If you are in the yellow zone, you should be cautious as your health may worsen. You may be experiencing more nighttime symptoms causing awakenings, increased shortness of breath, cough, wheezing, decreased activity levels, increased use of rescue inhaler, or your peak flow meter is between 50 to 79% of your personal best. At this time, you should continue maintenance medications. Use your rescue inhaler or nebulizer every 4 to 6 hours as needed, and possibly increase inhaled corticosteroid, long-acting bronchodilator inhaler use to every 4 hours based on your care plan. If your symptoms do not improve, you should call your pulmonary provider. They may prescribe rescue medications such as prednisone to help with your inflammation. Your provider may also assist you in scheduling an office or virtual visit before seeking further treatment. If you are in the red zone, you could be struggling to breathe even at rest, experiencing worsening symptoms despite rescue medication and steroid use, cannot do usual activities, develop bluish fingertips or lips, or your peak flow meter is less than 50% of your personal best. At this point, you must seek immediate medical care by calling 911 or going to the nearest emergency department. The most important thing you can do following an exacerbation is to continue your care plan and follow up with your pulmonary provider. For more information or to make an appointment with our asthma clinic, call 330-319-9700.